Right now, your kidneys are the only thing standing between your blood and a toxic cocktail of acid, fluid, and waste. The second they stop keeping up, your bloodstream does not just carry life. It starts carrying the chemistry that can drown your lungs, cloud your brain, and push your heart toward a rhythm it may not survive. And if that slide continues, a machine will have to touch your blood before death does. This is a science breakdown, not medical instruction. Subscribe for more extreme body science, because sometimes survival means your own organs are no longer enough. Most people think kidneys make urine. That is like saying a jet engine only makes noise. Your kidneys are chemical control towers for the blood itself. Every minute, they filter plasma, remove waste, fine-tune water, regulate acid, and help keep minerals like potassium in a range your nerves, muscles, and heart can tolerate. They also support hormone systems that affect red blood cell production and bone health. So when kidney function crashes, the problem does not stay in the kidneys. It leaks into circulation, and then every organ gets dragged into the same emergency. That is why kidney failure is so dark. It can start quietly. A little less urine, a little more swelling, a little more fatigue. Maybe food tastes wrong. Maybe nausea shows up for no clear reason. Maybe your head feels wrapped in wet cotton and your chest feels heavy when you lie down. None of that looks cinematic, but inside, the blood is changing. Waste products are rising. Extra water is staying trapped in the body. Acid is not being cleared properly. And potassium, one of the ions that helps control the electrical behavior of the heart, may be climbing toward the point where one silent change can become a lethal arrhythmia. So what turns deadly first? Sometimes it is fluid. Water the kidneys should have sent out of the body stays in the circulation, then begins seeping into tissues. Ankles swell, hands swell, the face can puff, then the lungs start paying the price. Fluid backs toward the chest, and breathing begins to feel like work you are somehow failing at. Each breath is shorter, faster, less satisfying. Sometimes it is chemistry. Potassium sounds harmless until you remember the heart depends on tightly controlled electrical gradients. Too high, and those signals can misfire. The body may look still while the risk becomes more electrical than visible, and sometimes it is the slow poisoning of the brain. When the kidneys fail badly enough, toxins and acid build in the blood, and the brain has to function in that altered environment. Concentration slips, reaction time slows, nausea deepens, fatigue becomes bone heavy. The blood is still moving, but it is carrying too much of what the body was meant to throw away. That is when dialysis stops sounding like a treatment and starts sounding like what it really is: an external rescue for failing blood. In acute kidney injury, dialysis may be temporary, buying time while the kidneys recover enough to take back the job. In advanced kidney failure, it may become part of long-term survival. But in both cases, the principle is the same. The machine is not stepping in because the body is slightly off balance. It is stepping in because the blood cannot be left like this much longer. Now picture the handoff. Blood leaves the body through tubing and enters a dialyzer, an artificial kidney. Inside that filter are thousands of tiny hollow fibers, together creating a huge exchange surface in a compact space. Blood flows through the inside of those fibers. Dialysis fluid flows around the outside, usually in the opposite direction. The membrane between them lets certain small molecules and water shift across while keeping blood cells and most large proteins where they belong. Waste can move out, extra salts can move out, excess fluid can be removed. Cleaner blood then returns to the body. That sounds almost calm until you remember what is being corrected. Dialysis is not polishing healthy blood. It is trying to drag unstable blood back toward a chemistry compatible with life. Urea falls, potassium can fall, extra fluid can come off. Acid-base balance can improve. Pressure on the heart and lungs may ease. The person may breathe a little easier. The mind may begin to clear. But this is where the story gets brutal, because your body does not always experience rescue as relief. If fluid is removed too fast, blood pressure can drop. Suddenly the person feels weak, cold, lightheaded, nauseated, or painfully cramped. Muscles may tighten in the legs or abdomen. The body that needed fluid taken off can start protesting the speed at which it is happening. The machine may be helping, but the sensation in the chair can feel less like healing and more like being wrung out from the inside. And then there is the darkest twist in the entire process. Dialysis can save the blood while briefly putting the brain in danger. A rare complication called dialysis disequilibrium syndrome is most associated with first treatments or situations where waste levels were very high before dialysis begins, including when chronic patients miss treatments. The basic problem is not infection or bleeding, it is timing. If substances like urea are removed from the blood faster than the brain can adapt to the new osmotic environment, water can shift into brain tissue. The blood is clearing, the brain is swelling, rescue has started, and the body can still move the wrong way. At first, the signs may sound small: headache, nausea, blurred vision. But this is not just a bad day. Restlessness can start rising like an internal alarm the patient cannot switch off. They may shift in the chair, unable to settle, feeling as if something is wrong without being able to name it clearly. Then thoughts start slipping. Focus fractures. Instructions feel farther away. The room can begin to feel strange, unreal, slightly disconnected. Confusion deepens. Agitation may grow. Someone already frightened by the machine can begin to look trapped inside a brain that is no longer tracking the rescue properly. In severe cases, that spiral can progress to seizures, coma, and death. Think about how vicious that is. The machine may be doing exactly what it was designed to do. The blood may be safer than it was an hour ago. And yet the body can still be overwhelmed by the speed of being pulled back from the edge. That is why medicine does not just ask, "Can we correct this?" It asks, "How fast can this body survive the correction?" Which sounds worse to you? The heart facing the potassium rise, or the brain struggling during the cleanup? Put heart or brain in the comments. And even if disequilibrium never happens, dialysis is still not a painless shortcut back to normal. Access sites can bleed, they can get infected. Fluid overload can remain dangerous if too much stays in the body, but removing too much too fast can worsen hypotension and symptoms. Some patients finish treatment exhausted, some feel chilled, some get headaches, some feel clearer only after the session is over. And because medicine is variable, not every person experiences the same symptoms, the same speed of improvement, or the same level of risk. And the machine has limits. Dialysis can remove wastes and extra fluid. It can help rebalance electrolytes and reduce the chemical stress pushing the body toward collapse. It can help control blood pressure by controlling volume. But it does not fully replace everything healthy kidneys do every hour of every day. It cannot fully take over their endocrine roles. It cannot erase damage already done by prolonged overload, severe electrolyte disturbance, or the illness that caused the kidneys to fail in the first place. It can support survival. It cannot instantly restore normal physiology. So what happens to your blood during kidney dialysis? Blood that was slowly becoming hostile to life is pulled out, filtered, rebalanced, and sent back as something the body can use again. Waste falls. Fluid can come down. Potassium can move towards safer territory. Pressure on the lungs can ease. The brain may begin to clear. The heart may get a better chance to hold rhythm. In acute kidney injury, that may buy time for the kidneys to recover. In long-term kidney failure, it becomes a repeated biological bailout because the body's own filtration system is no longer enough to protect the circulation on its own. And that is the real horror of kidney failure. It does not usually kill with one dramatic explosion. It kills by slowly corrupting the blood that every organ depends on. Dialysis is the counterattack, not gentle, not perfect, not complete, but often the difference between a body sinking deeper into waste, acid, fluid, and electrical chaos, and a body that gets another chance to stay alive. Tap subscribe for more dark truth science, and watch the next video to see what happens when the machine taking over is not cleaning your blood, but breathing for your lungs.